So Tine is a research associate in the Institute of Public Health and has been leading a very innovative program of work on the intersection between cognitive decline, dementia, and our current policies for imprisoning more and more older people. Tine.
Thank you, Peter. Can everybody hear me? Is that clear at the back as well? Because I know that's a bit challenging. I'll try to attach this. Right, now that I still have a captive audience, I would like to talk about prisons. And we're going to talk about social care in prisons in search of effective, implementable and sustainable solutions to care for older offenders. And this was a scoping study initially, which we are now following up with an implementation study as well. In terms of the content, I'm going to say something about a very brief background, aims and objectives, the policy context, practice, and also the issues that are being faced, the findings in terms of the models of care delivery in UK prisons, and actually I should say in prisons in England and Wales really, the current impact on policy services and strategic development, and also the anticipated impact on policy services and new research. So what is the background? Well, first of all, globally, we see that there is an increasing prison population, including older prisoners too. In England and Wales specifically, we see that in 2014, there were 10,587 prisoners aged 50 years and over. This is an increase of 6.8% since 2012, which is quite a lot. 50-plussers make up 13% of the total prison population and are the fastest growing age group in the prison estate. This also comes with age-related illnesses in prisons, as you can imagine. Older prisoners in prison suffer from the equivalent of what we would find 10 years older in society, for instance. So the illnesses you would find in, for instance, a 70-year-old person in society, you already find in 60-year-old people in prison. Also, disabilities associated with chronic conditions and lifestyle are much more common in the prison environment than in the community. And 50% of older offenders suffer from a mental health condition, 30% of depression. Despite this high prevalence and also the huge burden we see on services and on systems, there are very significant barriers to accessing care for older offenders. What is the reason of the increase we are seeing, and quite a rapid increase actually? Well, first of all, in general, growing populations, but also aging populations. Crimes later in life, and I want to point out something that I'm sure everyone has seen in the media, the Hatton Garden heist. Most, except for two people who have been arrested at the moment, were 50 or over. Tougher sentencing. We see tougher sentencing as well. Also revisiting of historic crimes, including the historic sex crimes we see now. Criminalization of health or mental health problems. And we were actually discussing the other day a very stigmatizing article in the newspapers, for instance, in relation to dementia, where there's an increase in police interventions in care homes of people with dementia, but also in the home. And media reporting can be quite stigmatizing and not very helpful in that sense as well. But also issues surrounding deinstitutionalization, whereby we see an agenda of deinstitutionalization, but if there's no adequate care in the community, for instance, and people are being failed there, that can potentially be a pathway to the criminal justice system as well. To give you an example here of one of the interviews, this is from a 67-year-old person in one of the prisons we did our research in. Issues around accessing care. For instance, this person says, I suffer from some health complaints, which ought to require treatment, but what healthcare is there? When I came in, I was supposed to be having an cardiogram every year. But I've been in prison for 2 years and I haven't had one. If it was a 50% possible that you were going to die, it is, I'd say, 100% likely in here. So against that particular backdrop, we wanted to look further into health and care, social care specifically in prisons, because social care has been pointed out in research to be a real lacking dimension in the wider care in prisons. So what were the overall aims and objectives then of our study? Well, first of all, the overall aim was to understand the current policy and practice on specifically social care for older offenders in a closed prison environment, and also to look at the most likely models for care and for support available post the currently implemented or enforced CARE Act 2014, which came into force on the 1st of April 2015. The very specific objectives we are looking at is to, we have completed it, complete a systematic review on covering social care support for both nationally and internationally models in prison, and to identify models of social care and support in prisons nationally and internationally. Also, to investigate current and potential social care provisions in the region in light of the CARE Act 2014, including the potential for serving prisoners also to support their older peers, peer support or buddying. To report and disseminate these particular findings and to work with our multitude of stakeholders to feed into current policy and development, because there is quite a lot going on at the moment indeed. We can be at the forefront of that. And to better overall care support of older offenders. And these are the key research questions, not limited to, but the key research questions we looked at. For instance, what type of care and support are offered to older prisoners? What type of care and support do prisoners provide to other prisoners? What evidence is there in the literature regarding effectiveness and support and cost effectiveness as well? And what challenges and opportunities are presented by the CARE Act according to the local stakeholders? Now, what did we find then in terms of the wider policy context, in terms of practice and issues being faced in this respect? First of all, it is absolutely clear from the research we carried out and also from the literature and from talking to a lot of stakeholders that UK prisons are mostly designed for younger, able-bodied and able-minded people. We see that before 2015, there is no clear responsibility for care assessments and for care needs. Social care was definitely not seen as the prison officer responsibility. And we see that healthcare quite often took the lead in social care issues as well, even though they were not clinical. We also saw a very sustained lack of capacity for preventative work, and we've heard that across several of the talks today as well, including in healthcare, but also in the prison estate. Older offenders' care is dealt with on very much a case-by-case basis, which means that there is inconsistent care. We see inconsistent care across the board with pockets of very good practices, but also with pockets of really bad practice. And a growing number of prisoners means that this is financially but also logistically completely not viable anymore, so there needs to be a clear pathway and guidelines. Offenders and some prison staff do care, mostly informally, for older offenders who are in obvious need of support, we found as well. And the new legislation, the CARE Act 2014, makes local authorities specifically responsible for social care needs and provisions, and with the prison service then having to meet any ineligible care needs under their duty of care responsibilities. So keeping particularly that last statement, which is now legislation, in mind, we also see that it is absolutely not clear yet how the requirements of the older prisoners of the CARE Act will be implemented, and this comes from all the stakeholders we have been interviewing. Who should care for older offenders also with very complex needs that require integrated approaches and multi-stakeholder responsibilities, for instance. And I'm thinking specifically about healthcare providers, about the local authority for social care providers, and about the prison. And we saw that some people were, that we spoke to were completely not aware, for instance, of the new CARE Act. and there were definitely issues surrounding who is responsible for what, particularly when high costs are involved. So what were our findings in terms of models of care delivery in UK prisons? Well, we found 3 major models. First of all, adapted accommodation, and all of that is provided by the prisons. Adapted regime, frequently involving third sector providers, and also peer support or buddying, which can be informal or formally delivered. Here we see mixed providers, often or sometimes including third sector as well, but mostly the prison environment. So in terms of adapted accommodation, we see, for instance, to give you an idea, that aids and adaptations such as here, you see the wall handles. Here in that middle picture, you see wall handles. Stair lifts, for instance, as well are being included. In-cell provisions, such as, for instance, providing meals inside of someone's cell, or books as well. But also a prison hospice, or a separate older prisoners wing, for instance. What we see in terms of adapted regime, and this is frequently involving third sector providers, we see older prisoners forums, and in the prisons where we have been working, this was actually quite popular and very well received as well. We also see, for instance, older prisoners sessions such as day centers, crafts, board games, etc., and special prison gyms, gym sessions, for instance, or over 50s clubs. In terms of the peer support and buddying we identified, often provided by third sector organizations as well, we saw formal peer support coming from outside, quite often listeners, for instance, but also informal peer support, as you can see here, the wheelchair pushers. Now, in terms of the impact of these findings, we have highlighted these particular findings in terms of issues in the system and in the services, and demonstrated the main models of care delivery to NOMS, which is the National Offender Management Service of the government, to prison services, to local authorities, the NHS, Public Health England, other people in academia, and third sector organizations. And based on that, NOMS requested for us to present the findings at their headquarters in July, which we will do. And we've also been able to generate much more debate, not only locally, but also now nationally and even internationally, teaming up with many more partners regionally, local authorities regionally, Ministry of Justice and Department of Health, the Alzheimer's Society, Age UK, with comparisons with Scotland, for instance, in terms of the policy and legislation there, and so forth. What does that mean now? Well, the National Offender Management Service has invited us also to share our findings and the work in progress on their local government knowledge hub, which is an online forum for prisons and for the CARE Act 2014, because we're going to look now at the implementation of that. We're also at the forefront now. We've got that golden opportunity now to be at the forefront of strategic development in this sense, and also let our research coincide with developing policy and also impact implementation and delivery of services in the prison estate, but also back into society, that transitioning. So we have been invited by NOMS, therefore, also to look at other areas of health and social care, which we are going to discuss with them. And we have been requested to improve, and we have heard that quite often today, partnerships, networks, nationally, well, locally, nationally, and internationally as well, because that is really important too. Now, in terms of the anticipated impact on services and on potential new research, for services, we have currently an implementation project running whereby we work collaboratively with the Alzheimer's Society as well and with several of the prisons across the region. And we are specifically looking at tailored interventions, educational and non-educational, for making prisons more dementia-friendly, because this is a big issue, and we do a process evaluation there as well, and hopefully we can present the findings next year. In terms of new research, national policy leading into services, NOMS has requested close collaborations to work specifically on integrated care, on continuity of care, and also on discharge from prisons models and pathways for older offenders with complex needs. And that will take place in July, and hopefully again next year we will be able to give a full update on that. And in conclusion, echoing a lot of what has been said today, what we believe truly is a recipe for success in that 1 year in a very challenging environment with quite challenging stakeholders as well, actually. We do believe that the recipe of success was not only to identify real needs in a system or in services, and in this case it was it is rather a challenging environment in the prison estate. Taking that systems approach, and we heard that throughout the day, we took that systems approach, we identified all the key stakeholders within that system, we networked, a lot of our time went into networking, into building bridges, into building trust as well, through openness, through good communication, through ownership of the stakeholders as well, of the entire process, so that they also see what is in it for them, and that we create that equal playing field, if you like, where there is room for talking to each other, where people do feel valued, where there is room for creativity and innovation, and to look at sustainable solutions. Also, in terms of leadership, and I'm speaking now specifically for our project, of course, we have been able to provide that leadership, and that doesn't mean necessarily that you know everything about everything, because that's absolutely not possible, but it meant that we saw the bigger picture, we had that overview, and we were able to see the factors and actors involved, to pinpoint the stakeholders and the experts needed to collaborate, and also to build that trust, to bring people together, and to communicate and to get things done. So to bring sustainable, positive change, hopefully, and we hope to be able to feedback on these exciting, hopefully, developments that we will see in the future. Thank you very much.